I'm joined by Nicholas Axas from the Kingston Health Sciences Centre. Welcome. And
Thank you.
you also were the chair of the fundraising drive for that organization. And how did you do?
We actually did really well. We went into the year not knowing what COVID would bring us, and we were just hoping that we could meet our target from last year. And what was impressive is that our staff turned out. We actually exceeded our goal from last year. We raised over $66,000. And what we found is that even during COVID, even being frontline healthcare workers, we still wanted to help, and people still wanted to be able to provide to the United Way. So we were very excited that we were able to at least meet our goal for this year.
That is great. So obviously you couldn't have the big events and the barbecues and all the usual thing. So what did you do instead?
So we were innovative. So what staff did is they said, you want to wear jeans on a Friday, pay us a toonie. So we had Toonie Jean Friday in some units. Usually we have a chili cook-off or a bake sale. We couldn't do that this year. So instead, what we did is we actually reached out to our senior leadership here at the hospital and asked them to donate some incentive gifts to get people to participate. And what we decided to do was to make sure that we could give back to the community as well. Our leadership went to local businesses in Kingston and the surrounding area and purchased gift certificates, because we also know that the businesses in town are also struggling during COVID. So that way we were able to use the incentives of a gift card to a store or a shop or a restaurant that does takeout, so that we could make sure that we could still provide the incentives for staff, and and also support the community at the same time.
It's terrific because everybody's had to pivot, and the United Way has done extremely well, all things considered, and the need is even greater this year than ever before. So they've pivoted with their services as well as their fundraising efforts. So what is the plan? Are you staying on for next year?
I think so. We've got a good team now. This is the second year we've all been working together. So I think we're going to stick it out for another year to do the United Way campaign in 2021. And we just want to thank just the community and all of the staff at KHSC for coming together and supporting the United Way. They're such a wonderful program. And you know what? They support us too. We have my detox center, which is part of my program in mental health and addictions, is able to get money from United Way to help for the residents that attend there. And with many of our patients, they access the United Way in the community. So it's a valued service.
It is, and it's people that you would think would ever benefit from the United Way, in fact, do benefit from it, and that makes your job easier. And yeah, I get it. I do. Congratulations on having such a successful campaign, and I guess you can kick back a little bit until next fall.
A little bit. Thank you so much, Donna.
Okay, take care. Bye-bye.